Imagine a disease once declared eliminated in the United States, now ripping through communities again, forcing entire schools to shut down and hundreds to quarantine. That's not a nightmare. It's happening right now. The U.S. is now facing one of its worst measles surges in decades, with significant outbreaks in South Carolina, Utah, and Arizona, igniting alarm among health officials and families alike. Measles, a virus once thought vanquished on American soil, is spreading rapidly, and the consequences are serious. A growing crisis. Measles back with a vengeance. In 2025, measles has re-emerged as a major public health threat in the United States. According to the latest data from the Centers for Disease Control and Prevention, CDC, nearly 1,912 confirmed measles cases have been reported across 43 jurisdictions this year, a dramatic increase compared to recent years. Health officials have identified 47 outbreaks nationwide, and the virus has spread far beyond isolated pockets, reaching communities large and small. With more and more states reporting new cases, some experts warn that the country could lose its measles elimination status, an achievement first earned in 2000 after decades of successful vaccination efforts. Why measles is surging: low vaccination and high contagion. Measles is one of the most contagious viruses known to science, so contagious that if one unvaccinated person enters a room, up to 9 out of 10 nearby unvaccinated individuals may be exposed and infected. Despite the availability of a highly effective vaccine, the MMR vaccine is about 97% effective with 2 doses, vaccination rates have dipped in several communities. Some areas now have far fewer children vaccinated than the 95% coverage needed for herd immunity, leaving pockets of the population vulnerable. In several outbreaks, especially in South Carolina and the Utah-Arizona border region, most infected individuals are unvaccinated, and many are children and teenagers. Hotspots of the outbreak. South Carolina. In the upstate region of South Carolina, particularly Spartanburg County, measles cases have soared. The state recently reported 114 confirmed cases, with the outbreak linked to exposures at schools, churches, and within households. More than 250 people, including many school children, are under quarantine as health officials try to contain the spread. At Inman Intermediate School, dozens of students have been quarantined, while the outbreak has also been traced to exposures at places like the Way of Truth Church in Inman. Health authorities are watching closely because the outbreak shows no signs of slowing, despite efforts to isolate infected individuals and their contacts. Utah and Arizona. In the West, a large outbreak centered along the Utah-Arizona border, especially in Mojave County, Arizona, and southwest Utah, has become one of the largest in the country. More than 170 cases have been reported in Arizona, with notable spread in Utah as well. Many of these infections occur in communities with low vaccination coverage. In Salt Lake County, one recent case occurred at a child care facility attached to a high school, prompting immediate public health action because the infected person was present while contagious. What quarantine looks like: a community disrupted. Measles isn't just another rash-causing illness. It can be serious, especially in young children. It spreads through respiratory droplets, and because people are contagious before symptoms even appear, health officials often resort to quarantine and isolation to break chains of transmission. In South Carolina alone, more than 250 people are in quarantine. Multiple students are away from school during the incubation period, which can last up to 21 days. Quarantine orders affect regular life, school attendance, and family routines. Complications and risks: more than just a fever. While many people recover from measles with supportive care, rest, fluids, fever management, the disease can cause serious complications, especially among young children and those who are unvaccinated. These can include pneumonia, encephalitis, brain swelling, hospitalization, especially among children under 5, death in rare cases. In 2025, 3 deaths have been reported among measles patients in the United States, including 2 children and 1 adult, marking the first deaths from the disease in the U.S. in nearly a decade. the threat to elimination, a historic status at risk. One of the most alarming aspects of this outbreak is the looming risk that the U.S. may lose its measles elimination status, a designation meaning that the disease is not continuously circulating within the country. Continuous transmission of measles for 12 months or more could officially label measles as endemic again, a devastating setback for public health. This risk has been underscored by experts who link ongoing outbreaks, especially the long-running cluster that began in West Texas earlier in the year, to a pattern of persistent virus circulation that could erase decades of progress. What's driving the outbreak? Public health experts point to several factors fueling the current surge. Low vaccination rates in some communities, especially where vaccine hesitancy or exemptions are common. Return to travel and social gatherings, especially around holidays. Communities with historically low MMR coverage, providing environments where measles can spread rapidly. Incomplete immunity, even among some partially vaccinated individuals. The vaccine works. Prevention is possible. The MMR, measles, mumps, rubella vaccine is safe and highly effective. One dose, about 93% effective. 2 doses, about 97% effective. Health officials strongly recommend vaccination, particularly for children, international travelers, and adults who have not received 2 documented doses. Increased MMR coverage remains the most effective way to curb outbreaks and return measles to its eliminated status. What you can do. Practical advice. If you live or travel through affected regions, ensure vaccinations are up to date. Watch for symptoms: fever, cough, runny nose, red eyes, rash. If exposed or symptomatic, stay home and avoid contact with others. Follow local health guidance on quarantine or isolation. Contact your doctor or local health department if unsure about exposure or vaccination status. Final thought: a return of a preventable threat. Once thought banished from everyday life in the United States, measles is back in a big way, driven by gaps in vaccination and ease of transmission. The current outbreaks in South Carolina, Utah, and Arizona highlight a broader challenge. Maintaining high vaccine coverage is not just a community advantage, it's a shield against diseases that can quickly reappear when that shield weakens. As health authorities scramble to contain outbreaks and protect vulnerable communities, the choices families make today, especially about vaccination, will influence whether measles becomes a fleeting crisis or a long-term public health setback.
Thanks for watching. If you enjoyed this update and want to stay informed with fast, reliable news, don't forget to subscribe to Newsflash 360. Hit the notification bell so you never miss a story. Your next headline is just seconds away.